Okay, thank you very much. It's great being here and being part of this meeting. Wish I was in California instead of being on a Zoom call, but anyways, I practice north of the border in Canada. It's a country of about 37 million people, and I'm here in Toronto. And we've certainly had a different COVID experience here north of the border than what we're seeing down south. A lot of this has to do with our previous SARS experience. This photo here is the Peace Arch Park that is situated both in British Columbia and in Washington State. The border between Canada and the US represents the longest unmilitarized international border in the world. So as I was saying, we've had previous experience with SARS, and a lot of that led to sort of some degree of preparedness for a pandemic such as COVID. We received reports in very early January, late December, based on military intelligence, and also a pandemic surveillance system at the University of Toronto. And so that drove a lot of the preparations to being prepared for COVID-19. Our first case was very similar to what the US experienced. Ours was January 25th from a Canadian citizen returning from Wuhan. We've certainly had a very unified approach for COVID in Canada. This is Prime Minister Trudeau, and unfortunately his wife actually came down with COVID early on. And that certainly helped drive a lot of our responses to some degree. And so the nation acted fairly quickly. A lot of our health policy is set by the Chief Public Health Officer of Canada. And regardless of political affiliation, this is our Premier of Ontario. All provinces cooperated under one policy. In terms of a federal response, we had a relatively late border closure for international visitors. Currently, we have no non-essential travel into Canada, and also we actually still have a border closure with the United States right now, starting in mid-March 2020. And at that time, the Prime Minister actually asked all Canadians to return home. I was actually in Miami at that time and had to fly back up pretty quickly. So I practice in the province of Ontario. It represents about 40% of the population in Canada. And we stopped all elective surgery on March 15th. And this was to ensure we had enough beds for a potential surge. We were seeing what was happening in Italy. And at that time, our numbers were extremely small, but you can see on this new case incident graph that we were in the midst of an exponential rise. So at the time of our shutdown, we actually had only 25 new cases being reported in Ontario with a total of 145 cases. So just as a background, in Canada and including Ontario, we have a universal healthcare provider, and it's the Ministry of Health in each of the different provinces. Everyone gets covered. Basically, you can go in, get your operation, get COVID tested without having to worry about a personal bill as a patient. On the surgeon side, we're fee for service, meaning you get paid for what you do. The reimbursement is based on pre-negotiated rates for different codes, for different procedures. And I practice in an academic institution. It's one of the largest neurosurgical and orthopedic training centers in North America. But most surgeons, including in the academic environment, are incorporated as businesses. And just as background, we have very limited number of spine specialists in Ontario and across Canada. For example, we have only about 20 spine surgeons for a population of about 5 million in Toronto. So in terms of the financial impact.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.